my name is Stephanie. I'm a student family nurse practitioner and I will be examining you today. I just washed my hands. Can you tell me your name and date of birth?
Kelsey, March 20th, 1989.
Okay, from looking at her head, the skull is symmetrical, normocephalic, and atraumatic. Looking at her scalp, there appears to be no lesions, no redness, no scales. I'm now going to palpate. Any tenderness?
No.
Okay, the hair appears to be evenly distributed, soft and fine in texture. Looking at her face, it is symmetrical with no scars, lesions, redness, or masses. I will now be palpating your temporal arteries. Pulsation is 2+. Any tenderness?
No.
Okay, do you wear glasses?
No.
Okay, great, thank you. I will now be performing a visual acuity test. This card is 14 inches from your face. Cover your left eye, please, and read the bottom line from left to right.
LTFPH.
Okay, now cover your right eye and read the bottom line from right to left.
HPFTL.
Okay, patient's visual acuity is 20/20 bilaterally. Looking at her eyes, they appear to be linear and symmetrical in shape. Her eyebrows appear symmetrical with even hair distribution. Eyelids have no redness or swelling. Eyelashes have even hair distribution as well. Looking at her irises, they appear to be well defined. They are brown. Her pupils are equal and round and about 3 millimeters in size. Sclera appears white, no redness, no jaundice noted. I'm looking at the medial and lateral canthus. There appears to be no swelling, redness, drainage, or crust noted. I'm now going to pull your conjunctiva up. Please look down as I do so. And now I'm going to pull down while you look up. I'll be doing the same at the other eye. Bilateral conjunctiva is pink and moist, no redness or drainage noted. Lacrimal system appears intact with no swelling or drainage. Corneas have no opacities. Please look at my nose. Okay. Corneal light reflex equal bilaterally. I'm now going to shine a light into your eyes to see how they react. Pupils are equal, round, and reactive, 2 millimeters with moderate reaction bilaterally. I'm now going to shine a light into your left eye and look at your right pupil. Now I'm going to shine a light into your right eye and look at your left pupil. Consensual pupillary reflex, equal, round, and reactive, 2 millimeters with moderate reaction. I'm now going to ask you to look at the wall, and now at my pen in front of you. The patient's pupils dilate when looking at an object from afar and constrict when looking at a closer object. Pupils are positive for accommodation. I'm now going to conduct a visual field test. I'm going to have you cover your left eye while I close mine. Let me know when you see my wiggling fingers.
No.
Okay, I'm going to have you cover your right eye while I close mine. Let me know when you see my wiggling fingers.
No.
Okay, confrontational test is positive, cranial nerve 2 is intact, patient's peripheral vision is intact. Again, look at the pen. Please follow with just your eyes. Okay, no nystagmus noted, cranial nerves 3, 4, and 6 are intact. I'm now going to perform the cover and uncover test. Please look at my nose. I'm now going to cover your left eye. No strabismus noted. Look at my nose. I'm now going to check your right eye. No strabismus noted. Now we're going to move on to the fundoscopic exam. Okay. Please look at the wall in front of you. Okay. Red reflex is noted bilaterally with no opacities. I'm now going to look at your right eye with my right eye while I hold your head for stabilization. Retina appears to be orange, no edema, no AV nicking noted. Retinal vessels intact, disc margins appear sharp. Horizontal diameter of cup is less than half the horizontal diameter of disc with a 0.4 disc ratio. Macula is intact. I'm now going to be looking at your left eye with my left eye while I hold your head for stabilization. Retina appears to be orange, no edema, no AV nicking noted. Retinal vessels intact, disc margins appear sharp. Horizontal diameter of cup is less than half the horizontal diameter of disc with a 0.4 disc ratio. Macula is intact, no opacities in either eye. Okay, I will now be assessing your nose. Looking at it, it appears symmetrical. I will be checking for patency. Breathe in and out. Breathe in and out. Patency is equal bilaterally. Now I'm going to check your sense of smell. Close your eyes. Okay, what do you smell? Right? Okay, keep your eyes closed. What do you smell?
Vanilla.
Great. Cranial nerve 1 is intact. Now I'm going to palpate your nose. Any tenderness?
No.
Great. Now I'm going to palpate your maxillary sinuses. Any tenderness?
No.
Now I'm going to palpate your frontal sinuses. Any tenderness?
No.
Okay. Great. Now I'm going to look inside of your nose. Okay. Membranes appear pink and moist. No redness, bleeding, drainage, masses, lesions, or polyps. No septal deviation noted. No perforation noted. I'm going to be looking in the other nair. Membrane also appears pink and moist. No redness, bleeding, drainage, masses, lesions, or polyps. No septal deviation noted. No perforation. Looking at her lips, they appear pink and moist with no swelling, cracking, or lesions. Can you please smile with your teeth for me? All right, dentition is good. Gums are pink and moist with no bleeding, no swelling noted. Now open your mouth and stick your tongue out. Okay, tongue is midline, pink and moist, no swelling, no masses, lesions. Now I'd like you to stick your tongue out and say ah while I use the tongue depressor. Alright, uvula remains midline, buccal mucosa pink and moist, soft and hard palates appear moist, no masses or lesions noted on either structure. Lift your tongue please to the roof of your mouth. Okay, tongue appears pink and moist, no swelling, no masses or lesions. Can you open your mouth and say ah again? Tonsils are absent bilaterally, pharynx without exudates or erythema. Did you have a tonsillectomy?
Yes.
Okay, thank you. Now I will be moving on to the hearing test. I want you to cover your right ear. I'm going to be whispering 3 words to you and I'd like you to repeat what you hear.
1, 2, 3.
Okay, great. Now cover your left ear. I'm going to whisper 3 words. I want you to repeat.
ABC.
Okay, great. Gross hearing intact bilaterally. Now I will perform the Weber test. I'm going to be placing this tuning fork on top of your head. Let me know if you hear in both ears.
Yes.
Great. No lateralization, no sensory neural loss present bilaterally. Now I will be conducting the Rhine test. Do you hear the sound?
Yes.
Let me know when it stops.
Stop.
Okay. Do you hear the sound?
Yes.
Let me know when it stops.
Stop.
Okay. I'm going to do it on this other ear as well. Let me know. Do you hear the sound?
Yes.
Let me know when it stops.
Now.
Do you still hear the sound?
Yes.
Let me know when it stops.
Stop.
Great. Air conduction is greater than bone conduction bilaterally. Now I'm going to inspect your ears. Looking at your ears, the auricles appear symmetrical with no redness, no swelling, no masses noted. I'm going to palpate your mastoid process. Any tenderness?
No.
Okay, I'm going to palpate your tragus. Any tenderness?
No.
I'm going to pull on your pinna. Any tenderness?
No.
All right, now I'm going to look inside your ears. I'm going to start with the right ear by pulling it up and back. Okay, tympanic membrane is visualized. It's pearly gray, intact, no perforation, no scarring, bleeding, or drainage. Minimal cerumen noted. No masses, no lesions present. Cone of light at 4 p.m. Malleus and pars flaccida intact and noted. I'm going to be doing the same in your left ear. I'm pulling it up and back. Okay, tympanic membrane is visualized. It's pearly gray, intact, no perforation, no scarring, bleeding, or drainage. Minimal cerumen noted. No masses, no lesions present. Cone of light at 7 p.m. Malleus and pars flaccida intact and noted. Now I'm going to inspect your neck. No visible palpations, masses, or goiter noted. I'm going to be palpating your lymph nodes. Let me know if there's any tenderness. So, starting with the pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical, deep cervical, supraclavicular. Now, any tenderness?
No.
Okay, now I'm going to palpate your trachea with 1 finger. Trachea is midline with no deviation noted. Any tenderness on palpation?
No.
Okay, now I'm going to have you take a sip of water while I palpate your thyroid. I'm going to feel for your cricoid cartilage and supraspinal notch. Take a sip for me. Okay. Thyroid appears midline. Both lobes noted and equal in size, no nodules. Any tenderness?
No.
Okay. Now I'm going to look at your anterior chest wall. No obvious retractions or bulging noted. Patient appears to be breathing comfortably with symmetrical chest expansion noted. No retractions, no use of accessory muscles. I'm going to palpate your chest for any masses. Any tenderness?
No.
Okay. AP diameter is 1 to 2. I'm now going to percuss, starting at the apices. Resonance heard at all lung fields. Now I'm going to listen to your lungs. I want you to take a breath in and out when you feel my stethoscope. Breathe in and out. And out. And out. Out. Okay, breath sounds are present in all areas with no adventitious sounds noted. Now I want you to sit on the side of the chair so your back is facing me. Move the chair this way. Great. Okay. No bulging or masses noted. Okay, I'm going to be palpating for any tenderness. Any tenderness?
No.
Okay, now I'm going to be palpating for chest expansion. Take a deep breath in and out. Chest expansion is equal bilaterally. Now I'm going to perform tactile fremitus. Okay, say 99 when you feel my hands.
99. 99. 99. 99. 99.
Okay, tactile fremitus felt equally bilaterally. Now I'm going to percuss, also starting at the apices. Resonance heard at all lung fields. Now I'm going to assess for diaphragmatic excursion. I want you to take a deep breath in and hold your breath. Dullness is noted at this point. Now take a deep breath in, exhale, and hold. Okay, dullness is noted at this point. Difference of approximately 4 centimeters noted. You can breathe regular. Now I'm going to be listening to your lung sounds, and I want you to take a breath in and out when you feel my stethoscope. Breathe in and out. Okay, breath sounds are present in all areas with no adventitious sounds noted. I'm now going to be assessing for egophony. Please say E when you feel my stethoscope.
E, 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 E.
Okay, I heard E, no conversion to A, so no consolidation present. I'm now going to perform whisper pectroliloquy. Please whisper 1, 2, 3 when you feel my stethoscope. Okay, 1, 2, 3 is very muffled and barely audible in all areas, no consolidation present. Finally, I'm going to perform bronchophony. I want you to please say 99 when you feel my stethoscope. 99 is muffled and barely audible in all areas, no consolidation present. And that is the end of our exam. Thank you very much.